Hi, everyone, and welcome to After the Diagnosis, it's a webinar series presented by the Neuroscience Family Advisory Council here at Boston Children's Hospital. In this webinar series, we'll be talking to caregivers and providers about diagnoses that we face and giving a completely different perspective on them. Today in this episode, we're going to be discussing Moyamoya. We have two different participants, each with a different background, and we're super excited to get started. So we'll introduce our participants. My name is Dylan Kirsch. I'm the co-chair of NFAC, as well as a clinical research assistant in the Department of Neurosurgery. And first we'll go to Dr. Ed Smith. Dr. Smith, what was your path quickly to where you are? How did you find yourself interested in kind of neurosurgery and cerebrovascular conditions?
Well, my path to get here was first I drove in on Longwood Avenue and parked, but earlier than that, I grew up, I'm a local. I grew up in Dartmouth, Massachusetts, nearby. And one of the really sort of seminal figures in Moyamoya and in pediatric neurosurgery was my mentor named Mike Scott. Dr. Scott actually operated on one of my childhood friends when I was in high school. And subsequent to that, I really, just like the commercial, I just wanted to be like Mike. And so as I grew up and went through college and med school and residency, I really gravitated towards trying to end up in pediatric neurosurgery and working with Dr. Scott. Once I was fortunate enough to do my fellowship here at Children's and spend time with him, and he was silly enough to hire me over 20 years ago, it really began that career path that I'm on now. I love the patients. I think that it's incredibly gratifying and also heartbreaking at times, but certainly when things go well, very, very gratifying to work with children. As a parent myself, I think there's some really, clear understanding sometimes of the importance of what we do. And through that, I've been very fortunate to have that relationship with Dr. Scott and to really guide me to where I am today. So that's how I ended up where I am right now.
Wonderful. And Jen, what was your path? How did you find yourself interested in neurosurgery? Kind of all the fields you could have chosen as an NP, kind of how did you choose neurosurgery and CSIC in general?
So I've been a nurse since 2007, and I worked on a neuroscience floor at the Brigham. And then when I became an NP, I always wanted to work in neurosurgery because that's always what I loved as a nurse. So I saw a job here and I thought it would be a great fit for me because it was an inpatient outpatient job. And I was here for about a year and a half when Dr. Smith and Dr. Orbach developed the CSIC group. And I had always enjoyed taking care of the vascular patients ever since I started here at Children's in 2013. So I thought it would be a great fit for me. It was a brand new role, and I actually got to kind of develop my role now, and it's expanded, and we have another nurse practitioner, Christoher Isibor, who will be joining us, I think. But I love taking care of the vascular patients. It just really interests me, and getting to know the families from diagnosis through treatment, through their follow-up is just a real joy for me.
Wonderful.
And we've been very, very lucky to have her. She and Christopher have been just absolute real godsends and have helped the program incredibly.
And I know there are countless patients out there that have worked with, all three of you that would absolutely say the same thing. We hear this acronym CSIC. So let's take, a minute or two and talk about that program. Is there a Moyamoya program within CSIC? Kind of what do you treat? Why come to the Boston Children's Hospital CSIC group?
So first of all, CSIC is probably the worst acronym. While I think we're probably the best program, we have the worst acronym. It stands for Cerebrovascular Surgery and Intervention Center. Basically, within Boston Children's, there was this innovation, this idea, about 14 years ago, where the thought was, traditionally people would go see a certain type of physician. They would see a neurosurgeon, or they would see a neurologist or an orthopedic doctor or whatever. But in reality, diseases are complex, and particularly for the more challenging conditions, they're often what we call multidisciplinary, many different doctors working together that bring different types of specialization to one disease. So for example, with the diseases we treat, It's not just the surgery, but you may have the nursing care afterwards. You may have a neurologist that might help with seizures or stroke recovery. You might have a geneticist who helps with understanding the root causes, and bringing all those different specialties together under one roof is not only easier for the families, they kind of get one-stop shopping when they come for their visits, but equally important, and perhaps even more important, it creates a team where we talk to each other and we're working together to get the best plan of care for the child. So that's what CSIC, the acronym, stands for, and that's what the group does. Essentially, we really work as this multidisciplinary team where instead of being divided by departments, we are brought together by shared and common diseases. To your second point, is there a Moyamoya subgroup within there? We really just have a very limited and focused number of conditions that we treat within CSIC. Moyamoya is one of the sort of canonical, core, really most important ones that we do treat. Part of that is because Boston Children's has the highest number of pediatric Moyamoya cases in the country, and that's based on the national database, the KIDS database. It is a very rare disease, but it's a very, very important disease. And as a result, the Moyamoya program, the group of teammates we have a very deep and specialized, high volume experience with this. And this extends not just within the CSIC group, but with our anesthesia team, our intensive care unit team, our floor nurses, the child life specialists who help take care of the kids while they're there, really every facet from soup to nuts for taking care of the kids, not just during their operation, but before their diagnosis. We have an excellent administrative team that helps get everything onboarded to routine follow-up where hopefully the kids are doing better and doing well. And it's just sort of a once a year or even more rare checkup as they live their lives and hopefully do well after the diagnosis. So that's what the program is and its focus on Moyamoya.
Sure. And I mean, not to talk up my own role, but that also means that, research is very intensive here in terms of Moyamoya as well, correct?
It is. So we have, I believe, one of the largest research programs on pediatric Moyamoya, not only in the country, but in the world. We're involved with and lead several major organizations. So we're part of the International Pediatric Stroke Organization. We're a part of the what's called the Boston, London, Toronto, the largest centers for vascular disease for kids in Canada, in the United Kingdom, and here. We have several dedicated research programs, including laboratories. I have my own laboratory working on this. We publish our work. We do research. We've been very fortunate to have both, national and federal funding from the government, as well as philanthropic funding. And putting this all together has really helped us to advance the care of kids with Moyamoya. We have a lot to do. We have a lot to go. But much of the work we've actually designed and developed here and in collaboration with others are now part of the national guidelines from the American Heart and Stroke Association.
Yeah.
So I think that research that we do is really hand in glove with the clinical care we provide. And one of our goals is to try to learn as much as we can so that every kid we take care of gets the best care possible. And the care we give today is always better than the care that we gave yesterday.
Yep. So let's talk about Moyamoya, and I'd love to hear from you both. In kind of two sentences, like what is it? When you talk about Moyamoya, what is it? What are symptoms that children present with? What's the diagnosis process look like? And then I guess finally, is this something you develop or are you born with it?
So at its core, Moyamoya are probably multiple different diseases. Just like some people say pneumonia, right. But it looks the same on x-ray when you look at an x-ray of your chest, but it can be from a virus, it can be from smoke inhalation, it can be from a bacteria. So many different things lead to a same common problem. What we call Moyamoya was first described decades ago in the 1960s in Japan. And what it really means is sort of critical blood vessels that go up into the brain and bring blood to the brain get smaller, they get narrower than they should be. Just like traffic in Boston, you might have a 10-lane highway go down to 3 lanes. And the result of that is that the blood that is supposed to get to the brain doesn't get there as quickly or as reliably as it should.
Right.
The consequence of that is that you can have temporary interruptions in brain function, which are called transient ischemic attacks. And Jen will very commonly get calls from patients who are having those kind of spells. Those are temporary. Unfortunately, sometimes the blockage or the narrowing progresses to what's called a stroke, where a physical part of the brain can die from lack of blood supply. And that is the real danger of Moyamoya, is that you can get strokes. We know that without treatment, about 66% of kids with Moyamoya will have a severe or major stroke within 5 years of diagnosis if they don't get treated. And that's why it's such a dangerous thing. This is something we think that luckily you can do very well from with surgery, but we think that most of the time you're born with the genetic predisposition to it. Historically, there's been one gene, this one mutation that's been found in people from Asia, typically Japan, China, and Korea, called RNF213, but our research and others have found many other genes that are associated with this. And this is where one of the major research efforts are ongoing, because we want to know, is this a one and done if a child has it, or should we be worried about your family members? And that answer is different depending on who you are and what you have. There are kinds of Moyamoya that can be acquired, where, for example, we see children sometimes who have had radiation therapy. If they, for example, had a brain tumor, they might have been successfully treated for their brain tumor, which is great. But as part of their treatment, they got radiation, and essentially the scarring from the radiation, which fixed their brain tumor and kept them alive, unfortunately can have the side effect of narrowing the blood vessels. This is very rare. And I don't mean to scare people off radiation, because it's a life-saving treatment, but that's a second way that Moyamoya can happen, other than the genetic predisposition, is by radiation. So that's a little bit of what Moyamoya is, why it's dangerous, and then what, you know, the causes can be. Jen, I don't know if you want to comment a little bit on you know, what you hear from patients in terms of, you know, I've talked about the background, but what do they feel? What do they present like? You know, what do they, when you get a call, what are some of the things that families may complain of or talk about as symptoms?
Sure. So, you know, Christopher and I will get calls from families. You know, they may be having headaches, speech difficulties, weakness on one side of the body, you know, rarely can have, you know, some seizures or things like that. But most of the time we get called and saying, you know, my child's having a headache. Is this something we should be worried about? You know, they were running around playing. It was a hot day. They're, you know, I noticed they were a little bit weak on their left side or their right side. You know, and depending on, you know, if they've had their surgery already, and, you know, that may have been a side that they had a stroke on, you know, we can kind of talk them through that. You know, ask them questions about, you know, how long did it last? You know, did it get better if you hydrated when they rested? And we can kind of give them ways to deal with that at home, and then kind of give them, you know, guidance on, you know, this, oh no, this actually sounds like a true emergency. You should come to the hospital.
Right. And then, so I know we briefly touched on treatment, and, you know, we've done a few of these episodes, and some people will say, you know, these are conditions that we can manage conservatively until we're ready to really intervene. What does the treatment look like for Moyamoya? I know it's primarily surgical. Are there any other options? Like, is this something that can be conservatively managed? You know, kind of what does that look like? And what does that treatment decision look like for you, Dr. Smith, and for Jen and Chris, like after the fact, after surgery, what does that management look like kind of before discharge, during the hospital stay?
So maybe I'll start with my part, then Jen can go to hers if that's all right. But basically, if you know you have Moyamoya and it is real disease that's advanced, the treatment is surgical, and that's the national guidelines. That's not debatable. There is no medicine that makes it go away. There is no, you know, fancy food you can eat. It is a physical problem of poor blood flow, and the treatment is surgery to create new blood vessels or new blood flow. There are two important caveats to that. First is there are times where we're not sure it's Moyamoya. And in those situations, sometimes what we say is, boy, maybe it's very, very early and we're not sure that it's Moyamoya. Maybe it's, you know, something else like an inflammation or an infection. Other times it may be that there are other conditions that look like Moyamoya, and we have to do some testing to figure that out. And in those cases, sometimes we give a little blood thinning medicine like aspirin to buy us time while we do our testing. The second caveat is that sometimes, even if we know it's Moyamoya and it's really advanced, if a child has had a recent big stroke, it may not be safe to operate right away because the stroke has such swelling or irritation that we know that going under anesthesia may make things worse. And we have to play the odds and say, let's give it a few weeks, let the swelling die down, and then we can do the surgery. So there's really a balancing act in terms of being sure we know what we're doing. Measure twice, cut once is the surgery and the carpentry rule. And then even if we know it's Moyamoya, if they've had a recent stroke, sometimes we have to balance the timing. The surgery itself, there are many, many different names. There's a whole litany of confusing big terms: direct, indirect, pielsenangiosis, burr holes, you name it. At its core, really all we're doing is saying the sick blood vessels inside the head are built differently typically than the blood vessels outside the head. Embryologically, we know that these are usually not sick. So whatever the physical type of surgery is, the core principle is the same, which is we make a hole from outside to inside. We take the healthy blood vessels from the outside and in some way introduce them to the brain. So again, just like the Boston traffic here, if I-93 is clogged, you can take Route 128. And at the end of the day, the brain doesn't care where the blood comes from as long as it's getting the blood that it needs. So that's really why surgery is important, how we figure it out, and the way or the principle behind surgery. So once we do the surgery, then the recovery is a little different. And maybe to your second question, Jen can sort of give us some feedback on what surgery recovery is like and what to expect. So Jen, maybe you can answer that.
So typically we tell patients they're going to be in the hospital for about 3 to 5 days post their surgery. In the ICU, for the first night, we're really monitoring their neurostatus closely, monitoring their blood pressure, making sure they're staying hydrated. If all goes well, and they're doing well on post-op day 1, we start, trying to wean their fluids, getting them out of bed, resuming their aspirin, and then working toward getting them home. And we, at discharge, we're, talking them through, encouraging them to resume their, keeping on their aspirin. So we talk about, staying hydrated, and, also kids' biggest questions are getting back to activities. And, we usually hold off from activities for about 4 to 6 weeks until we see them on post-op. And we work toward getting them back to normal lives. And that's the goal, always families are, thinking that they won't live normal lives and won't be able to do normal kid things. But generally our patients get back to doing everything normally, playing sports, going to school, going to college, all the things that every kid wants to do. So
you answered my next question before I even asked it. So that's perfect. So we have a few questions left. What should a parent kind of know and do once the patient is diagnosed? Like, are there certain patient advocacy groups or BCH resources that you guys have found that are very helpful for families to kind of understand their new diagnosis?
There's no specific advocacy group that I know of within the hospital. As in every diagnosis, you can go to Facebook, and there are tons of Facebook pages that families are on. So I know I've heard from families that they've found Facebook groups, and they've heard about us on there. So I know families go to that for a lot of help and support. But I know I've seen a lot of the Facebook groups for Moyamoya are more adults than kids, but there are a lot of Facebook groups on it.
Yeah, I mean, there are actually some very good groups that are focused on Moyamoya that are starting to build some of their family and pediatric focus. And, if you contact us, we're happy to sort of connect you with them as well. I will say, if people get diagnosed, we have on our website series. Unfortunately, it's me blathering away, but it's the commonly asked questions.
Yeah.
What is it? What does it do? And while you're hearing some of this now on this seminar, a lot of it is available for you to go back and think it over. It talks about everything from soup to nuts. Again, I'm using that same phrase, but from the initial diagnosis to what it is, to the surgery and the recovery. So there's a lot of that there. I would caution you not to get too deep into Dr. Google. There's a lot of either misinformation, scary information, or information that might be correct, but not applicable to you. So if you have questions, we're here to help. And we're parents first and doctors second. Hopefully we're sympathetic to what's going on. So, as we're sort of wrapping up here, I would say that we're here as a resource to help you. There's information on our website. If you look up CSIC or Ed Smith or, Moyamoya at Boston Children's, there are links there. And anytime you need help, please just reach out to us directly. We're glad, and the office is usually great at very short turnarounds. We're happy to look at films. We're happy to talk to families. But our job is to help with our expertise in whatever way we can. And we're here for you.
Yeah. Jen and Chris, before we wrap up, if you were to tell a parent or a patient one thing about Moyamoya, what would you say?
That generally we think your kid's going to be okay. You need to do surgery. But although some kids can get sick, but a lot of our kids do well. So to get good opinions, go to a high volume center. But things will be okay.
Like Dr. would say, the expectation is your kid will live to be 100 years old and a grumpy old man or woman.
Fantastic. Awesome. Well, thank you all for such a fantastic conversation. Please be sure to head to the Neuroscience Family Advisory Council's website, linked below, for more resources and information. And stay tuned as we announce more After the Diagnosis episodes on many more neuroscience topics. Thank you guys so much, and have a fantastic rest of your day.